Hello to everyone, my name is Helen Herrera and today I'm going to talk about Cutis Verticis Gyrata associated with acromegaly. I'm a med student at Universidad Católica de Santiago Guayaquil, and here are my Facebook, Twitter, YouTube and Instagram accounts so you can follow me and watch the other videos I have uploaded. Definitions. What is Cutis Verticis Gyrata? Cutis Verticis Gyrata, also known by the name of Pachydermia verticis gyrata, Cutis verticis plicata, and bulldog scalp syndrome is a rare benign cutaneous disorder that is characterized by convoluted folds and deep furrows of the scalp that mimic cerebral palsy and gyri. Another question we have is, what is acromegaly? Acromegaly is a disorder that results from excess growth hormone after the growth plates have closed. It develops when the pituitary gland produces too much growth hormone during adulthood. A common sign of acromegaly is enlarged hands and feet. People with this disorder often notice that they are unable to put on rings that used to fit and that their shoe size has progressively increased. Acromegaly may also cause gradual changes in the shape of your face, such as protruding lower jaw and brow, an enlarged nose, thickened lips, and wider spacing between your teeth.
A man in Brazil has a rare medical condition that makes his skin on his scalp wrinkle into folds that resemble the wrinkles of a brain. He started developing the pattern of folds 2 years ago when he was 19 as a symptom of a medical condition called Cutis verticis gyrata. Doctors from Brazil's hospital, Universitario de Santa Maria, studied his condition and noted that he didn't wear hats to cover it up and that it was not a cosmetic issue for the young man. One of the doctors, dermatologist Karen Shantz, said, "It's a benign and essentially aesthetic condition." Doctors don't know what causes the rare condition that also affects hair growth and is more common in men than women. Another rare condition that hasn't even been named yet is afflicting a Canadian infant. Doctors are explaining the condition as a deletion of a chromosome. Baby Caden is missing 37 genes and needs ongoing and intensive treatment, which amounts to thousands of dollars in hospital bills.
Application in medicine. Cutis verticis gyrata now falls under three categories: primary essential, primary non-essential, and secondary. Primary essential CVG has no other associated abnormalities. Primary non-essential CVG is associated with intellectual disability, neuropsychiatric disorders, seizures, schizophrenia, cerebral palsy, and ophthalmologic abnormalities. Secondary cutis verticis gyrata has been reportedly associated with pachydermoperiostosis, cerebriform intradermal nevus, acromegaly, and other less frequent causes of CVG. According to the National Institutes of Health, more than 95% of people with acromegaly have a benign tumor affecting their pituitary.
So this is the second excision. We excised this 2 weeks ago for scalp reduction for CVG. And now today we're doing our second excision, which is this piece of scalp in the form of one of the gyruses, if you will. And now we're going to close this, and then you won't have that excess skin anymore. Okay?
Pros and cons. Pros. Cutis verticis gyrata can be treated surgically by removing the excess of pulp. As in this case, a pituitary tumor is the cause of acromegaly and secondary CVG, the excision of the tumor solves the problem. And the cons, other changes that occur in acromegaly, such as excess growth of face, hands, and feet, are irreversible.
Acromegaly is actually quite a rare disease, occurring about 3.5 patients per million per year, and it's caused by growth hormone production by a pituitary tumor. The symptoms of acromegaly can be subtle and very slow in onset, and those include changes in the sizes of your hands and your feet, as well as facial features, which include enlargement of the nose, protrusion of the jaw, something we call frontal bossing, which is enlargement of the brow bone. The issues with acromegaly are that the disease oftentimes comes on slowly over a period of years. So even though we can normalize the hormone in the long haul, some of the symptoms and signs of acromegaly are not reversible, including the bony changes that occur. In addition to the changes in the bony features, acromegaly can also be associated with fatigue, hypertension, diabetes, oftentimes induces joint pain, can sometimes cause sleep apnea, and carpal tunnel symptoms. Acromegaly is classically treated with surgery. That is the first-line treatment for the disease. If the tumor is less than a centimeter by a centimeter in size, the cure rate with surgery approaches 80 to 90%. However, if the tumor is larger than a centimeter by a centimeter in size, the cure rate does fall and sometimes approaches around the range of 50%. Clearly, having an expertise of a good neurosurgeon is critical in the treatment of this disease. If we do not achieve a surgical cure with acromegaly, what are the options for treatment? Well, those include medications which can help to control the levels, and in addition to that, radiation therapy with CyberKnife and gamma knife therapy, which is an exquisitely pinpoint treatment for brain tumors and pituitary tumors alike. The advantage of using CyberKnife or gamma knife therapy is really a bullet-like approach to the tumor and sparing the rest of the brain tissue from radiation effect. Unfortunately, because the pituitary gland is such a small gland, when we are targeting the pituitary gland in the sense of the tumor that lies within it, we can sometimes knock out pituitary function. So anyone who has radiation therapy, gamma knife or CyberKnife, to the pituitary gland does have follow-up with us long-term to assure that the pituitary function remains normal. And in addition to that, if indeed the tumor is close to the optic nerves, then radiation therapy is something that sometimes cannot be achieved without damaging the optic nerves.
Issue in Ecuador. Cutis verticis gyrata is predominantly seen in men, with a reported prevalence of about 1 in 100,000 males and 0.026 in 100,000 females. There are reports of CVG in Ecuador, but no further data has been collected. In conclusion, we have that Cutis verticis gyrata associated with acromegaly can be cured by treating what is causing the acromegaly, which in most cases is a pituitary tumor. The skin folds in the head can be corrected surgically. And here is a video about it.
Three tumors removed, 3 skin grafts done on the scalp. Third skin graft was rather deep and didn't really take.
This is the first, as far as we know, this is the first transplantation of the scalp and skull, and also the first transplantation of these organs or any craniofacial tissue.
This is a microsurgical procedure. And to get the bone and the scalp tissue to survive in the new location, you have to connect blood vessels under a microscope with little stitches about half the diameter of a human hair.
Well, I didn't have this much hair, so it looks better. Looks better.
Thanks for watching.